welcome to the space where knowledge meets the action. Welcome to the Empowering Show, where we break down the barriers, helping you grow. Financial literacy, speaking truth to the power. Real conversation, changing lives by the hour. We inspire to change, here we challenge the status quo. Sharing tools for building wealth, watching your seeds grow. Empower you to take control of your future. No more living in the past, we're the authors of the suture. Get ready, get set, let the movement begin. Because empowerment starts now, let the light in.
Good afternoon, everyone. Happy Wellness Wednesday, everyone. I'm Nurse Connie, your daily companion on this journey to a happier, healthier you. So Wednesdays at 4 p.m., we're all about hitting pause, checking in with ourselves and refreshing our routines. Whether you're looking for a boost of energy, a little stress relief, or fresh health ideas, keep you smiling, I am right here with the tips and the support you need. So let's get right into it. This week, we're going to focus on perimenopause and menopause. So your questions will be answered. It's called the change, the time of life, or the menopause transition. Call it what you will. It's an unavoidable fact that all women, as well as some trans men and non-binary people, will go through menopause. So for many, this natural process can be an anxious time due to symptoms that can accompany it, changes brought on by cancer treatments, hormone therapy, aging, however you experience it. We're going to try to explain menopause and what we can do to make things easier. So what do we mean by menopause and perimenopause? So perimenopause, this is the time leading up to your periods stopping. It can start in your late 30s or your early 40s. Your hormone levels begin to fluctuate, which is often when symptoms are at their most noticeable. So, and menopause is defined as that point when you have not had a period for 12 consecutive months. So sometimes you ask, when should you worry about spotting during your menopause? So it's normal for people to skip periods, sometimes for several weeks or months during perimenopause. However, what's not normal is having periods less than 21 days apart, experiencing bleeding or spotting in between periods, or bleeding more than 10 days. So that's very important to remember. Menopause is defined as the point when you have not had a period for 12 consecutive months. So even if you go say 10 and a half months, 11 months, and then that period comes back, unfortunately, you are not in menopause. So then the cycle starts all over again. For most, this happens between the ages of 45 and 55 years old. However, research suggests that Black and Hispanic women may reach menopause roughly 2 years earlier than white and Asian women. So if this happens before the age of 40, it is referred to as premature ovarian insufficiency, also called POI. So if you have your ovaries removed, your menopause is immediate. Um, for example, if you have a total abdominal hysterectomy that includes an oophorectomy, which is the removal of your ovaries, you will experience menopause. However, if you still have a hysterectomy and you still have your ovaries, you will not um, experience those flashes, night sweats, and those types of symptoms. So, why does this happen? It happens because of changes in your hormone levels. Um, During your fertile years, your ovaries produce estrogen. As you get older, your store of eggs decrease and your estrogen levels drop. This doesn't happen overnight. The process can take several years, which is why symptoms can come and go. Um, and then with the perimenopause, you wonder, well, how does that feel? What does that feel like? Every person's experience of menopause is different. Some breeze through it with no symptoms, while others are frustrated. They have disturbing symptoms that include hot flashes, night sweats, excuse me, sleep disturbances, tossing and turning all night. You can have intimate issues like vaginal dryness and painful sex, urinary bladder urgency. So that sensation to go to the bathroom and void, and you have to go immediately, or you'll have mild leakage. Some other concerns would be mood swings. You can have mental issues from menopause, anxiety, brain fog, or difficulty concentrating. Long term, though, lower estrogen can lead to thinner bones, which can cause osteoporosis. So, how do we diagnose it? In most cases, you do not need a blood test to diagnose menopause if you're over the age of 45. So basically, your symptoms and changes in your periods are the most reliable indicators. So if you're suffering from those hot flashes, night sweats, tossing and turning at night, mood swings, anxiety, brain fog, and your periods are not regular, you can easily self-diagnose as menopause. Um, on the other hand, if you are under the age of 40 and you had a hysterectomy or an ablation, uh, your healthcare professional may use blood tests to check your hormone levels as your periods are no longer available. So you may ask, what's an ablation? And then endometrial ablation basically is an invasive medical procedure that is used to destroy or remove the lining of your uterus, also called the endometrium. And the primary goal is to permanently reduce or stop heavy menstrual bleeding in women. Um, the procedure typically takes about 25 to 45 minutes, and most people feel normal within 2 to 3 days. They might have some mild cramping and watery discharge for about a week, but for the most part, they should be fully recovered in about 2 to 3 days. So, another question you may ask is, if you're on contraception, can you stop your contraception or birth control? So if you're under the age of 50, you should continue your contraception until you have not had a period for 2 years. If you're over 50, you can wait 1 year without your periods to stop. So what are some things that you can do to combat these symptoms? First and foremost, maintain a healthy lifestyle. Maintaining a healthy lifestyle is an investment in your future health, and you should be intentional about your diet. Eat a balanced diet, low saturated fats, low salt. Ensure you get plenty of calcium and vitamin D in your diet. Calcium would be in foods like milk, broccoli, green leafy vegetables, and your vitamin D. All these nutrients help to protect your bones. And aim to maintain a healthy weight. No one's saying do a crash diet, but just be intentional about the things you put into your body. Exercise. Aim for about 150 minutes a week. You can walk, go swimming, do strength training, weight resistance, to keep your bones and muscles strong. Very important during the menopause, because as you age, muscles tend to atrophy. So as long as you're intentional about your diet and exercise, having a significant amount of protein and muscle mass in your diet is very, very important. Smoking. If you smoke, now's the time to stop. Smoking is a known trigger and more frequent with severe hot flashes. Yeah. So if you smoke, I would recommend you quitting. Alcohol. Stick to fewer than 14 units or drinks in a week, and that's being very gracious. And have at least 2 alcohol-free days. A high intake of alcohol can worsen symptoms as well as increase breast cancer risks. Your breast cancer risk. So yes, alcohol is a known breast cancer risk. And do not forget about your emotional health. Don't ignore your mental well-being. Be conscientious of your stress reduction. Use mindfulness. Talking therapies can be effective. Eliminate those stress factors or minimize stress as much as possible. If you feel your heart racing, or you're starting to shake, or you have that, you're starting to feel anxious, you might have to step away from whatever the situation is, even if it's work. Go to a safe space, go into your break room. Maybe when you take lunch, you might need to step out the building and go sit in your car, or go for daily walks during your lunch breaks, just to reduce your stress and just to be mindful of your mental health. So what are some things that they're using now to help ward off the symptoms? Some of the treatments that are available are what they call alternative remedies and supplements that can help with mild flashes. And they have these natural elements like black cohosh and soy, isoflavones, as well as moisturizing jellies that you can use for vaginal dryness, different types of gels, or what they call KY jellies. Those can help as well. Then you have cognitive behavioral therapy. You can do yoga, because though yoga is very helpful with mood changes and sleep issues. Once again, Exercise, I would throw exercise under cognitive behavioral therapies. Make that part of your daily routine to help with your mood swings, um, and to release those endorphins. And then hormone replacement therapy. According to the research, it is the most effective treatment for menopause. But I take pause with hormone replacement therapies because a lot of the hormone replacement therapies have severe side effects where they can cause cancer, uh, like progesterone and certain estrogens can cause breast cancer. Um, and so be very conscientious, ask lots of questions, tailor those treatments um, in different doses and forms, ask all the questions of your healthcare provider about the dosing and what the regimen is like for hormone replacement therapy. It is not for everyone. Um, so if you can go what they like they say the non-pharmacological route, the more holistic route, I would say take that route first, and then your lastly, if needed, a hormone replacement. But in my experience, I would do that last. Um, so basically, in a nutshell, every woman experiences menopause differently. It's helpful to remember that your body is changing, as it did in puberty when you were a teenager. Uh, while it can be challenging, understanding the changes allows you to make the right choices for your body. So, help is available. Uh, it's all about hitting a healthy routine. It's all about being consistent. It's all about listening to your body, asking the right questions to your providers, and making the right choices for yourself and your body. So, help is always available. We are here every Wednesday to take questions. So, if anyone has any questions at this time, please like and subscribe to our YouTube channel. Give us a call at 570-664-0574. And we're here to take all your questions. Right now, we're going to go to a commercial break and we'll be back. Happy Wellness Wednesday.